One of the latest advancements in spinal surgery has been the advent of the artificial disc for the cervical and lumbar spine. The cervical spine has actually had more utility associated with an artificial disc as opposed to the lumbar spine due to less load-bearing characteristics and requirements of the cervical spine compared to the lumbar spine. The implant that I use is called the Mobi-C from LDR, and it is a mobile bearing device or an artificial disc replacement for the cervical spine that was approved by the FDA in 2013, and it's actually the only artificial disc that's approved for 1 and 2 levels. The remaining implants that are out and available on the market are only available and approved for 1 level implantation. The indication for an artificial disc replacement is typically in a younger patient that doesn't have a lot of underlying arthritis or neck pain. This typically is for patients that have isolated neurogenic or radicular pain, usually secondary to a disc herniation of the cervical spine. And usually this is limited to 1 or 2 levels of pathology of the cervical spine. The benefits of using an artificial disc is it doesn't require more responsibility for the disc above and below the surgical site, such as that we encounter after a fusion. The artificial disc allows us motion in lateral bending, flexion, extension, as well as rotation, which maintains very similar mechanics to the normal cervical spine and disc. Artificial disc replacement surgery is typically done on an outpatient basis, usually done in a hospital setting or can be done in a surgery center as well. In contrast to a typical decompression and fusion procedure, an artificial disc surgery doesn't require the patient to be in a collar for 6 weeks after the surgery. The problem with having a patient immobilized while that fusion heals is it tends to make their neck quite stiff, and then we're going to have physical therapy required to regain that motion and also overcome that stiffness that has occurred secondary to immobilizing the neck while we're waiting for that fusion to heal. In contrast with the fusion, an artificial disc allows patients to start moving right away after surgery, and typically we have them driving within a week or 2 after surgery once any discomfort has settled down. Additional benefits of an artificial disc surgery compared to a fusion are patients are able to get back to work sooner. They don't have to wait with a collar for 6 weeks and have that stiffness and achiness from the collar that usually requires physical therapy to get them moving again. With an artificial disc, usually 2 weeks after surgery, we can get them back to sedentary duties or light duties such as office type work without too much discomfort or difficulty. As far as how the procedure or the surgery is done, this is the cervical spine in an upright orientation. Patients are laying on a table in surgery, and typically what's involved with is cleaning out the native disc that's causing the problem and cleaning out the disc herniation. I'll take this apart, give you sort of an idea what that looks like. We don't take the spine apart like this in surgery, but it gives you an idea of cleaning out in between the bones where the disc herniation is to clean out where the nerves come out the side of the spine. Once the disc has been cleaned out, we prepare the end plates and size up the inner space or the space where the disc used to be for the appropriate sized artificial disc. The artificial disc consists of 2 metal end plates and then a mobile polymer in between, which is held into place by the 2 retaining pegs, which can be seen here and here. Okay. With that polymer as an interval spacer, it functions to provide motion at that level of the cervical spine in flexion, extension, lateral bending, and rotation. Once the artificial disc is implanted, we obtain final X-rays in the operating room to make sure the implant is in good position and location. The alignment of the spine is anatomic. They're then transferred to the recovery room for post-operative recovery, and they're able to go home later that day.